Hi everyone, welcome back to the channel The Science of Time. This is Pratikshya Paul, a third year MBBS student, and today we are going to discuss everything about pharmacology. I hope this video will help you combating pharma, especially in your second year. Last year I made videos about how to study the first year subjects. Some of you might have watched them, but I guess many of you might not have. I'm not complaining, okay? But एक शर्त पे before watching this video, please make sure to hit that subscribe button and please like and share this video because content like these take a lot of time and effort. Now let's get into today's video. So first, let's discuss about the books available out there. So the gold standard books are Goodman and Gilman and Katjam, and then comes KDT and Shanbag that is used by everyone. And I'm not going to tell you to read Goodman and Gilman and Katjam because personally I never did. So let's come to Shanbag first. It is a student friendly book in terms of its language, writing, and its way of presentation. Many things are given in a flowchart manner, and it is easy to prepare your question answers for your theory exam from this book. So many students prefers it, and I think everybody knows this. Now let me help you with KDT. Almost everyone thinks KDT is too vast to read and retain, but certainly you do not have to read the entire book. There is a way to study pharma. Pharma means drugs, and there is a certain way to study drugs. It is easy to study the drugs under some headings, and it will be same for all the drugs. So these headings are class of drugs, mechanism of action and mechanism of resistance if available, pharmacokinetic parameters, use of the drug, adverse effect of the drug, and the contraindication of the drug. It is much more simpler to study the drugs under these headings. The next thing is classification of drugs. I know initially it is very scary to look into those huge classification given in KDT, and the first thing came into my mind when I saw them is, oh god, how will I remember them? Because there are so many classifications, so many subclasses of drugs, and under each class there are so many name of drugs. So how will I remember them? So this is how I made my way through it. The classification of drugs is given in the starting of each chapter in KDT. But this is not the first thing that you should try to remember in the chapter. Because in the starting of the chapter there are so many drugs and you will be feeling overwhelmed because of this. And also you do not need to remember all the drugs given in the list. 2 to 3 drugs under each subdivision is enough. Read the entire chapter first. Suppose you are reading antihypertensive. When you are done reading the entire chapter, now you know the mechanism of action that is leading to hypertension. And these are the sites that will be targeted by your drugs to decrease the BP. So basically you have to know the cause of the hypertension, like increase in renin, increase in AC, increase in aldosterone, increase sympathetic outflow, etc. Now these are the sites your drugs will be targeted against. So now you know your drugs will decrease renin, decrease aldosterone, decrease AC or inhibit the AC, and decrease the sympathetic outflow, and your classification is done. So this is the much more simpler way to remember the classification of drugs rather than just mugging it up. The next thing I want to suggest is another book, that is Harsh Joshi. Basically, it is an exam preparatory manual. Every chapter is given in question and answer format, and it is very helpful to read before your exams. Suppose you have started reading 2 months before your exam, which I do not suggest at all. But then this book is for you. It will cover all your chapters in a really short time because it is given in a very crisp, concise manner in question answer format. You can take the help of your PYQ list of your university and mark the important questions in this book and prepare them well, and it will be very helpful for your final exam. Now let's come to note taking. I will always suggest you to make your own notes in pharma because there are so many drugs, so many facts, and so many things to remember in pharma, so it can be overwhelming sometimes. But I also understand the fact that it is not possible to make notes of every chapter. So I will highly recommend you to make note of the huge chapters like antimicrobials, CVS, CNS and ANS. It will help you in long run in your revision of these chapters and your better retention. In pharma, one drug has so many uses and so many adverse effects which you can't remember easily. This is where mnemonic comes into play. Suppose you have to remember the use of tetracyclines. So the mnemonic here is RBC in plasma. The next thing I want to focus on is how to write long questions in pharma. Let's take the example of antihypertensives again. It is an important long question. Suppose the question is classify the antihypertensive drugs and describe the mechanism of action and side effect of the ACE inhibitor. So this is how you have to write the long question. And remember, you do not have to write unnecessary things. Write the key points first and write what is asked. Otherwise, even after writing pages, you won't get marks. Prepare all the long questions, short notes, and reasoning questions from the PYQ of your university. This will give you an overall idea of what are the questions and what can be asked further. So this will help you in your prof exams a lot. Okay, so the next thing is practical. In practical, there are spottings, ADR form filling, computer assisted learning, drug promotional literature, P drug, and there are also other things like injection techniques, etc. So these things you will be learning in your practical session in college. If you want to refer to any books, then I will suggest you the book Practical Manual by Dinesh Bardial. It is a decent book for practical purpose. One last thing I want to talk about is resources for lectures. If you have taken any subscription of any platform, then watch their lectures only because every platform is good. But if you haven't take any subscription, then these are some YouTube channel recommendations that will help you to learn pharmacology. So, these are all the things I want to convey to you about pharmacology. If you have any query or any doubt, feel free to reach out to me through your comments, or you can also DM me on my Instagram handle. I hope this video will help you in the best possible way. Thank you so much for watching, and I will see you in the next one. Till then, keep studying, keep learning.